Hi guys, welcome back. Sorry for the interrupted video which we did earlier on for the live video. We're talking about sleep paralysis. Well, I'll just take a little bit of your time and thank you for watching this video. Um, Elaborating what sleep paralysis is. So today we're going to check on sleep paralysis, what it is, what are the causes, what are the symptoms, and what are the do's and don'ts. We're gonna we're gonna um, see, and we're gonna talk about different ways of how to curb them or how to stop prevention on preventing on how you can end up on having sleep paralysis and such. So well, basically just in I just ideally I just analyze what a rough idea of sleep paralysis, of what it contains, of what it is about, and I would like to share with you all. So I'll start by the definition of the sleep paralysis. Besides, it's a feeling of being conscious. Sorry, it's a feeling of being conscious but unable to move. It occurs. It's a state, or rather, it's a state of being at the wakeful, at the wakefulness and sleep. At the wakefulness and sleep. Any, you're like half dead, half alive. Something of the sort. If you can try to relate that, thank you. Now we have also the causes. I know maybe you could be asking what causes are all about this kind of paralysis thing and the sleep paralysis. One, we have a change in sleep schedule. Secondly, we have stress. And thirdly, we have related sleeping problems, such as we have the mental health condition, such as PSTD, we have bipolar disorders, and we have narcolepsies. And as as we continue, we're going to see more and more of the causes of it, and you'll be able to understand what it entails. Um, we also have insomnia as well, if I don't forget. Now, what are the symptoms? How will you know, like you're under kind of sleeping paralysis thing or sleeping paralysis period or even episodes? One, hallucinations, and you have most of the time it occurs when you have nightmares, and it brings a sense of fear. You are unable to speak, move, any body parts, you're unable to move it, even the neck. Just actually your eyes just becomes open. Your eyes also, when I mean like open, it ends up so not becoming like wide open, like it's some sort of a dilated pupils. You'll be having like a dilated pupils. So you can imagine like you're in that people tend to think like maybe that's how the slow death comes all about. And you can imagine how in a paralysis state. It's really hectic and it's really so stressful. It's dramatic. It's terrific. And other one, inability to move, like I've mentioned. Then you feel like you're weightless feeling, and the other one you feel like you have chest pressure. That's why mostly when people get out from the sleep paralysis, they end up gasping for breath. You know, from the shock. From the anxiety, from the fear they're having. You know, it's like you bring back to life now. You're like, and then an out of body feeling. You feel actually in a layman's sense. So, like in this kind of a sleep paralysis thing, maybe when actually in that state, which I've said, like you're in a having like half alive, something of the sort, like an out of body feeling, like in just an essence, just try to picture out like you're going to take like you're removing yourself, your soul, then you it's appearing in front of your eyes, then you're trying to figure out how you can get back to your soul, back to your inner self. It's really so hectic. And basically, how to stop this thing comes all about. Basically, you have to work on your sleeping schedule, avoid use of excessive caffeine. There's some people who like drinking too much coffee when they're going to bed, or they want to have enough of it. Anything containing caffeine, just forget about it when you go to sleep. Just maybe minimum if you're too addictive, but don't take it much because it will affect your sleeping schedule or sleeping disorders. You're gonna get it. And the other one we have, if any chance maybe you have experiencing or having mental health problem, kindly go and visit to the doctor, or kindly go to the mental health facilities and go and be checked out for your own good and for your own proper lifestyle care. The other thing, what we have, the most important thing, I think, okay, to some also religion also they really do much focus on to not sleep on your back. Like Islam, we usually, I myself, I'm a, I'm a Muslim. We usually believe that sleeping on the back is not so really, it's not really something good. Okay, it's not something that is advisable actually out there to yourself actually. To avoid sleeping with your back, or rather just sleep with the sides, if your left side, right side, like normally that's how I myself I proceed. I usually take these procedures every time when I take a sleep or a nap. And other one are reduce, there's some people also during the day they have hectic days, they have experienced traumatic things, depression things, they've had a lot of work, maybe there's a lot of precious things in the during the day. They end up now thinking of their days, of how it has been, or even maybe taking remembering something which happened from the past. Also these will lead to you having sleep, just avoid thinking too much, or having too much stress when you're going uh, to your bed, or even getting to sleep, even you say, perhaps. Now, we're going to into the phenomenal of the sleep paralysis. Normally, they call it sleeping paralysis demon. You know, what kind of it's kind of hmm, even the statement itself, like sleep, the title, even the topic say like sleep paralysis demon. What do you really think it is? Well, it's actually a hallucination linked with sleep paralysis, which occurs when a person is jolted awake in the middle of the rapid eye movement. And in the rapid eye movement, which normally you'll hear people say REM, which is rapid eye movement phase of sleep associated with dreaming. I hope you get it. I'm going to repeat once more. It's actually the hallucination linked to the sleep paralysis, which occurs when a person is jolted awake in the middle of the rapid eye movement phase of sleep associated with dreaming. Now we have causes related with hallucination. So this is what happens. As a person drifts to sleep, their body begins to cycle through two types of sleep: rapid eye movement and non rapid eye movement. Now, during the REM, the rapid eye movement sleep, there is heightened level of activity in the brain and breathing. It usually affects your BPs, the blood pressure and the heart pressures, and the heart rate increases. This is a lot. Sorry, this is also type of the sleep characterized by the rich and detailed dreams and nightmares. You can see. Now we have actually paradoxically during REM, the rapid eye movement sleep, the body enters a state of temporary paralysis called the muscle atonia. Now this is the state likely a mechanism to prevent sleepers, actually not the sleepers for the future, but the sleepers, the do of the action, the sleeper from injuring themselves by acting out their dreams. After they have had those occurrences, now they're trying to pull out, like to get away from that kind of experience. In sleep paralysis, listen, is perhaps a state of being wakefulness which becomes blurred. Blurred. Like blurred vision. Like it's a clear state. You don't have exactly clue what is going on about. But in really, like, you can make something like physically movement for yourself. So this basically, it therefore lasts for 2 seconds, or even can last for either more than 3 seconds, or even, sorry, more than 3 minutes, like uh, 2 seconds to 3 minutes, perhaps. Sorry. So however, the person can think, you can see, you can breathe while they lie awake. You see, when you're still awake, like you're just looking at one position, your eyes are kind of dilated, kind of having dilated pupils, your eyes are that wide open. So you see, but you are unable to move any other of your body parts, maybe the neck, maybe even to speak out or even shout, maybe even you have to move your limbs, your arms, like your body is just in a stationary state. So sleep paralysis is accompanied by different kind of hallucinations. Now this is what happens when you are under an episode of sleep paralysis. You have certain hallucinations. So I'm going to list kind of a hallucination which happens in both of them, or rather altogether in general during the sleeping paralysis. Sleeping paralysis episode. Now we have intruder hallucination. It's described as a thing or having a menace feeling of something that is threatening you around you in your room or in your sleeping area. In this, you feel like there's someone, you're seeing someone, you feel like there's someone has entered maybe in your room and trying to attack, or maybe trying to, you know, to having a bad intentions or having any other intentions against you. So, and in the next we have incubus hallucination. It's whereby a person may feel that they are suffocating, thus experiencing chest pressure or chest press. You know, like the feeling like it's just like a punching bag being placed on the chest. You feel like you're suffocating. You feel like you can't breathe. You feel like there's just pressure on it. For that, if you go further to the researchers, they say there are some demons called hag. I don't know about much about the of it, but there's some demons called hag. They tend to might be sitting on your chest. They're applying more pressure on your chest, and you feel like you're suffocating. That's why if you're having sleep paralysis demon, something of the sort, you can try to relate that. Now, the other one, you have stibular motor hallucination. But the term motor, you understand something which is maybe moving. You feel like there's a sense of moving somewhere or something. It involves an imagined sensations, sorry, movements. So it involves imagined sensation, movement, out of body experience or feeling of bliss. Now let's get to associations accompanied by sleep paralysis and hallucinations. What are these some of associations? We can see what factors can lead to it. Like in terms of what maybe you could be having. So maybe you're suffering from something, or maybe you're having challenges according to your health or something of yourself. We have narcolepsy. Narcolepsy, it's a chronic medical condition in which a person's brain cannot control sleep awake cycles appropriately. We have idiopathic hypersomnia. We're going to check about that. It's a state whereby a body you experience a body tiresome feeling, like it cannot even be explained. Like, most of the time you feel like like you feel like you're tired, and you got nothing you have done, you haven't done nothing or something. It's something which is a confused way, you can't even explain it for yourself. And we have also obstructive sleep apnea, the OSA. What is this obstructive sleep apnea? Okay, it's a sleep-related breathing disorder caused by blockages in the airway. Later on, I'm going to explain you how this it's being related in terms of the do's and the don'ts. We'll get to say about it. Now we have the disease accompanied by the above disorders. What do I mean by the above? The sleep paralysis demons, for what the association, sorry, the association, what accompanies them. Maybe you could be having certain disease that you're suffering from that could perhaps the eye disease. We have migraines, we have dementia, we have seizures, we have withdrawal from alcohol, we have mental health condition, and we have Parkinson's diseases, and we have many others as well diseases. Maybe you can do researches on your own. You can see what kind of disease that can be accompanied by sleeping paralysis and hallucinations. What causes a sleep paralysis demon? Now that's a good question you need to ask yourself. It's being considered that the role of hormone, you know, mirror neurons, change in breathing, and survival centers of the brain. Now we're going to check on that. We have this hormone, actually it's called serotonin. Uh, It's when an individual begins to wake up, hormones like serotonin suppresses REM sleep and contribute to increase awareness of the person's surroundings. We have again the brain disturbance as the malfunctioning of the brain parts, which so this brain disturbance, basically, it's a form of the hallucination whereby you create it's a kind of it's some of the brain parts trying to create or form an image of the body part like a human being, human being like structures, you know which may underlie the creation of human being like figures after seen during hallucination period. Basically, it's also responsible for the sexual nature, phantom movements, and pain that sleepers maintains to have across the limbs, or maybe even the feel in the limbs. Some of the body parts, arms, some of them like that. And the breathing changes. You see, it's when a person in parallel state during the REM sleep, the breathing normally grows more shallow, becoming aware of the diminished breathing during an episode may explain the feelings of suffocation pressure on the chest that people describe during sleep related hallucination, as we have talked on earlier on. Then we have another thing, which is known as the cycle of fear and panic. This is when a person in a sleep paralysis state begin to realize that they cannot move, or even to shout. No voice can come out, can come out from your mouth. You know, there's that fear which may escalate and trigger the panic and fight you trying to move out. So those are the basically what entails with sleep paralysis, and also the sleep paralysis demon. You know, I believe you've mentioned on how to stop it, and how to curb about it. Just in case you're feeling maybe you could be having those experiences, the symptoms, you feel like I am experiencing some kind of a sleeping disorders. You could I will advise you to go for further checkup for the mental health, and especially the mental facilities. Maybe you could be suffering from a certain thing or a certain diagnosis that you can't know. It's better earlier than never, so they can get treated. Or even could be the some certain diagnosis you're suffering from, that when maybe it's just being controlled by a medication. Just when you get the medication, the minimal of you getting there'll be a minimal episodes for you getting this kind of a sleeping paralysis. Well, I guess this was the topic of the today. We were supposed to talk about it before the interruption for the networks. My name is Mr. Juma Yunus. I'm the CEO and the founder and the consultant at Yunus Home. So if you want to reach us out, you can share your comments or any queries at Yunus Homecare page, Facebook. Or if you want to reach me as well, Juma Yunus, Facebook and Instagram also maybe. And yeah, you can check us on that. Thank you so much for your time.